Welcome back. I hope you enjoyed your lunch and I hope you continued to network. My name is Sandra Garlick and I'm your host for today and moderator. I just want to remind you a few things. Remember to use that chat box. It's there for you to network. It's there for you to talk to each other. And it's also there for you to pose questions. And remember your platform. It's there to connect, to network and to collaborate. We had some great presentations this morning and they will be available to watch later on the Future Health YouTube channel, as will all the presentations from the 3 days. We're now moving on to our afternoon's programme, so just a reminder of what's coming up ahead. So first we'll be hearing from Jenny Scott from UKIHMA about the expertise in global healthcare market, and then we'll be moving on to our final presentation of the day from Ghafoor Ahmed, who'll be talking about the future of healthcare billing. So on to our first presentation this afternoon, and over to Jenny Scott, the General Manager from UKIHMA.
Hello everyone, I'm Jenny Scott, General Manager in UKIHMA, and I'm delighted to have been given this opportunity to tell you about UKIHMA, who we are and what we offer international clients. So UKIHMA stands for the United Kingdom International Healthcare Management Association, and we're a national organisation, membership trade organisation, established to provide expert integrated healthcare solutions to international clients. Our membership base ranges from large global multinational companies through to small SME niche companies on the commercial side, but we also have a number of prestigious NHS organisations and increasingly academic bodies, universities and colleges. And so all of these organisations are formed under the umbrella of UKIHMA and all offer a particular expertise to the international market. We were established about 8 years ago as a vehicle through which the UK could offer its expertise to the international healthcare market. And so we can tailor our solutions to whatever our clients require, be that a large-scale capital build with all of the elements within that, or a very defined data or education ask. So we are uniquely placed to offer these tailored turnkey solutions to international clients. The capabilities that we bring to the international healthcare market are very widespread. As you can see from the slide, we offer expert clinical advice. We do have a number of NHS and private clinical organisations involved in UKIHMA. And so if you're looking to develop clinical services or perhaps optimize existing services, we're able to work with you in working through what your needs are, what the driver for change are, and then some examples of models that may work well for you in your healthcare facility. We have access to finance. UK Export Finance is one of our partners. We work closely with them, as well as other financial institutions, in being able to offer funding for particularly capital schemes abroad. We're also able to advise our clients on how to access funding for particular schemes. We have a range of experts around our healthcare facilities, and I'll be telling you a bit more about this during the presentation, but we're able to work with clients in the initial scoping and feasibility of a large-scale capital scheme. We're then able to look at the planning, the building, the designing, and the commissioning of those facilities. So our membership includes construction companies, architects, engineers, designers, project managers. So we bring the whole package if you've got a large scale or even a small scale capital infrastructure project. Increasingly important to us is our education and training offer, and I'll be telling you a little bit more about that later on in my presentation. but we're able to work with clients in offering the full range of education and training, from formal academic education through to specialist training. Digital and data technology is becoming increasingly important. We can work with clients around demand and capacity modeling, around AI utilization, around digital systems in business working, but also we can use our digital and data technology in supporting our other areas, such as delivery of education and training through digital learning platforms. We also have a number of companies who are able to provide specialist equipment, and we've just established a life sciences special interest group looking at medtech, drugs and devices, and being able to offer that UK expertise to the international market. So as I mentioned, we do have a number of prestigious NHS organisations in our membership, and they range from oncology, cardiac, mental health, rehabilitation specialists, and they are the more tertiary specialist hospitals in the NHS. So they bring their expertise and their knowledge on the whole range of services that they cover, and that's from service design, delivery, the equipment required. So if you're looking to establish a specialist hospital, tertiary hospital, then we have members who can offer you their expert advice. We can support you in terms of developing specifications if you're going out to procure services. We can also advise you around service specifications for delivery and also standard operating protocols. So whatever you require in terms of the healthcare expertise, we have a member who's able to offer you that. So as I mentioned, we have a number of special interest groups, and all of our members are on one or more special interest group according to their area of interest. And the special interest groups reflect the capability and expertise of our UKIHMA members. So in terms of education training, we have both NHS and private education training providers. Each special interest group has 2 leaders, and I'll be saying a little bit more about the 2 leaders of the education group in a bit. But that group then can offer the whole range of education and training that you would require for your healthcare schemes. We offer consultancy advice, and that's a very broad range of advice, from clinical consultancy through program project management, legal finance. We'll be able to provide you with advice in terms of getting going on your project and delivering it. As I've mentioned previously, we have expertise in health infrastructure, and I'll be giving a few case studies of work that we have been involved in that. Healthcare operations and management, once you have your facility, you'll want to commission that, have it equipped, and you may want an operator to support you in operating that on an ongoing basis. So we have some very experienced operators who are able to work with you in driving that forwards. Digital data, I've mentioned. We have a range of organisations who can offer the full spectrum of digital and data technology capability. We then have a number of task forces for specific focus on key areas. We've currently got a Middle East and North Africa task force, but we're developing other task forces to reflect the wishes of our clients and the requests that we receive. We have special projects as well, where we do a time-limited piece of work, and I'll be giving you an example of one that we have developed and that we can offer you if that fitted your requirements. We also have a COVID-19 offer, where we as a collection of members can offer a full range of support, and that's ranging from the physical support around pop-up facilities or short-term medical facilities that you require, the equipment and other other elements such as PPE that you require. But also, once the surge of the pandemic may have passed, it's how we then support you in that recovery phase, getting services back up and running, and looking at your resilience and your capacity building for the future. Excuse me. So I first wanted to start off with our special interest group in digital and data. And where in this group, we're trying to drive advances and innovations in using digital and data technology. So we do have a number of organisations involved in this group, and every one of our special interest groups has a detailed brochure which articulates the offer they have, the members, gives you access to their website so you can look at those, and it shows some case studies of work that has been undertaken. So those brochures are all available on our website, and I'll be giving you the address at the end of my presentation. So this one is the digital and data, and what this SIG offers is data-driven business strategy, looking at AI, looking at patient and medical records, electronic patient and medical records, and looking at how digital innovations can support driving your business strategy. You may also want some demand and capacity modelling. If you're looking at some of your services and you want to know, you want to future-proof your facilities, we can support you in that demand and capacity planning around your patients and activity. So just a couple of case studies from our digital and data special interest group. This is one by one of our special interest group leaders, Methods Analytics. And this is a case study where Methods Analytics worked with the Care Quality Commission. And the Care Quality Commission is the independent regulator of health and social care facilities in England. Now, they go into all health facilities and they inspect them against key criteria, and they'll write up a report, and that organisation will be given a rating in terms of the outcome from that inspection. So clearly the inspections are very much data and information driven. There's a lot of information that's collected, but a lot of it is disparate pieces of information, and a lot of it is free text and narrative as well. So the CQC and Methods Analytics work together in looking at developing a decision support tool around those inspection visits. And Methods used AI in terms of collating all of this information, narrative and data, and developed a decision support tool that the inspectors in the Care Quality Commission can use to make sure that they've gathered all of the information, they've taken account of it all, and that it can support objectively in driving forward their work. Another area that we have specialism in is through a company called Patient Source, and they also co-chair our special interest group, and they offer expertise in electronic patient records and electronic medical records. And so what they're able to do is take disparate data silos and integrate them so that you as a client can see the whole picture around the data that you have, rather than separated silos. So this very much is an integration engine for use in your clinical systems within your facility. Moving on now to the infrastructure expertise that I've mentioned at the beginning. Again, we have a brochure that details the members and the offer. And as you can see, our expert offer in this special interest group spans the planning phase, and that might include the feasibility of a particular project, the legal and finance elements. And as I said, we can advise you in terms of sourcing finance for your scheme. Through to the design, we have some very prestigious designers, healthcare planners, architects as our members. We then move on to the building and equipping. So we have our construction firms that are able to work with you, and we very much drive innovation and new models of healthcare facilities with a strong emphasis on healthy buildings, looking at how we look at that holistic building and its contribution to health and well-being of patients. And we look at green facilities as well, energy efficient and sustainable facilities. We then move on to the commissioning and maintaining. So we can commission equipment, buildings, and then we can also support you in maintaining and checking back on the effectiveness and the efficiency of that healthcare facility. This is one example of one of our members, ETL, who are experts in strategic planning and strategy development, looking at clinical models of delivery and also looking at the demand and capacity planning. So ETL have been working with the Hamad Medical Corporation in developing and advising on the Hamad bin Khalifa Medical City development, which is a very extensive, prestigious development in Qatar. So they have been able to work alongside the client in looking at the need, in looking at the population, projecting what the need might be in the future, and then in designing innovative buildings that will be flexible, but will be future-proofed for future growth in demand. Another case study from this particular group is the work that we've been undertaking in Greece. And there are a number of our members involved in this initiative. You can see Llewellyn Davies as architects, ETL as that strategic service planner, Arup in terms of construction and design, and Mott MacDonald's. So this lineup of very well-known, globally influential organisations have been working with the healthcare planners in Greece around a number of new healthcare facilities. And in some of these, we've got renowned architect Renzo Piano to look at innovative design that's sympathetic to the environment, but that is sustainable and green. And one of those facilities is a new paediatric hospital in Greece. So this has been a real collaboration with the healthcare planners in Greece. And this is really an example of what UKIHMA can do. We pull consortia together across the full spectrum of our members to tailor our response to international clients' requirements. Moving on now to education and training. This is increasingly important, and post-pandemic, with the pandemic with us, we've had rapid digitization, and so we are able to offer a range of support through digital learning platforms, which is much more flexible for our clients. But we know that you can have a beautiful new building with lots of equipment, but if you don't have a skilled and expert workforce, you will not deliver excellent clinical care to your patients. And so this is really an increasingly important area for UKIHMA, and we have a fantastic group that can offer expertise across the spectrum of education and training. So as I said, fundamental to the delivery of world-class clinical care is having that expert team of professionals. So we can offer support and training across the full multi-professional team, and that's your doctors, your nurses, your allied healthcare professionals, but also administrative and managerial staff. So that full spectrum so that you can deliver excellent care to your patients. So we bring together both commercial sector education and training providers with our NHS partners and increasingly universities and colleges. So we can offer that spectrum. And these are just some examples of the members who are in UKIHMA who offer these facilities. eIntegrity is a company that offers a vast range of online courses and modules, and so you can see a whole menu, and that ranges from things like first aid training, emergency planning, it might be palliative care, so that full spectrum, they're able to offer you that. Pearson is one of our co-chairs of our special interest group, globally influential in education, and have a fantastic offer that they can provide. Advanced Clinical Solutions, again, an independent company that has a lot of experience both in the academic world, but also in specialist clinical skills training. And one example there of our NHS provider is the Royal Papworth Hospital, who can speak from experience and offer their expertise via digital learning platforms. So the expert offer of the Education and Training Group spans from workforce planning. You might have established a new healthcare facility and you're not quite sure what professionals or how many or what grade you would want in that facility. And that might grow over time as you expand your healthcare services. So we would work with you in terms of planning that workforce, in terms of numbers, grades, the kind of skills that you would need in your particular facility. We'll look at the clinical skills training required of those staff. We'll look at the academics. So we work on both undergraduate and postgraduate education, and we offer a range of support there. We work closely with a number of universities and with Health Education England. So that more academic formal training, we're able to facilitate your access to that, as well as the on skills training of your multi-professional team. Another area that we can offer is in terms of your clinical fellows and observerships. So if you were interested in some of your medical team or nursing team coming over and working alongside some of our prestigious NHS organisations, we can facilitate that. And that might be 1 or 2 year clinical fellowships, or it might be much shorter term clinical observerships. But whatever you felt you required for your workforce, we're able to offer that. So as you can see, our delivery methods are through e-learning, online digital learning, face-to-face, and also blended, a blend of those delivery methods. And so, you know, when we are able to come onto our client sites, or our client can come to us. So completely flexible, but with this digitization and the learning platforms, we're able to offer you access to those platforms from your own location, and then you can take yourself through those courses at the pace that you want to do. So moving on to our consultancy special interest group, we offer that full spectrum of advice. So we marry up the specialist clinical advice from our centres of excellence, NHS Excellence, and you can see a number of those listed there. We combine that with the specialist expertise of our commercial members, and many of them have been consultants, management consultants for many years. They have extensive experience. We have legal, financial, program management experience. So we're able to offer that full package around the clinical and delivery aspects of your requirements. So the expert offer, that just shows you what I've said. It's a whole range of offers according to what the need is. Just a couple of examples of our members. So Arup, one of our members in the consultancy special interest group, has been working with the healthcare planners in Australia around establishing the new Royal Adelaide Hospital, which is a $1.8 prestigious tertiary new centre. As you can see, very innovative design. And so Arup have been working with them in terms of from that initial feasibility to developing that facility, as you can see there. Another one that our members Foster and Partners have been involved in is this very innovative design for a Maggie's Centre in Manchester, which is next to the Christie Hospital, which is a major oncology tertiary centre. Now, the Maggie's Centre offers non-clinical advice and support to both oncology patients, cancer patients, and anyone affected by cancer, so that may be their families as well. And this is a lovely centre which is very informal, and people can go seek advice, attend classes, or just go and sit there and just be quiet. It's a lovely facility with open plan areas. People can sit quietly, or they have a garden area where if people would like to do a little bit of gardening or just be on their own doing a little bit of wandering in the garden, they're able to do that. So it's a beautiful facility, and so Fosters and Partners have worked to help design and make that happen. So in terms of the operators, I mentioned that we have a number of companies that can support in commissioning and operating healthcare facilities internationally. And they bring extensive experience, that many of them have been doing this for decades. So they bring their experience in both the commissioning and the operating of facilities, but also in assuring the that we work with our clients around the efficiency and effectiveness of that facility. So is it running really effectively? Is it driving value for money? And we will work with clients in terms of evidencing that. So the offer in this particular special interest group covers from that initial scoping, and you can see a number of the special interest groups overlap with one another. They're not separated. They do very much work across each other's boundaries. So we can support around the scoping, the feasibility of a scheme, the commissioning of that facility, the operating of it and the longer term, and then that assurance around value for money and effectiveness. So these are just three of our global operators: Pioneer, International Hospitals Group, and OCS are highly experienced operators of healthcare facilities, and they would work with you to provide you with that assurance. So something that we've been developing is around creative problem solving, because sometimes people that approach us, they're not entirely sure what it is that they want. They know that they have a need, but they have either faced challenges in taking that forward, or they'd just like support in articulating that need and really getting going in meeting the need. So we've developed an offer whereby we would work closely with the client to help them articulate what the need is, their healthcare need, and perhaps any barriers that they've been facing. We'll field a team that's relevant and appropriate to that need. So it might be cardiac facilities, it might be diabetes, it might be provision of virtual clinics, whatever the requirement is. We'll field a team with the expertise to facilitate an exploration of that issue. So we'll hold workshops, virtual workshops at this point in time. The expert team will work with the client. We'll have a questioning and sharing of ideas and exploring of options session. And we will then present a table of recommendations for action, options to take forward. And if the client wanted to, we could work with them in terms of developing business propositions around that. So this is a new exciting area for us. We're going to be taking it forward with a number of different colleagues in different countries. And so if you wanted to find out more about how we could work with you, then please do get in touch with us. So in drawing to a close, the commitment that we offer international clients is to support them in realising their ambition for excellence in the care they offer to their patients. We've spoken about the expertise and the knowledge and skills that we could bring, but we would work alongside a client, recognising that they want to offer that excellent clinical care to their patients, and we want to support them in that. What UKIHMA brings is a vast range of UK expertise across the full spectrum of requirements, and we can then work with our clients to develop solutions and options that will take them forward to meet their needs. And then what we offer is respected and trusted organisations. Our members, many of them are internationally renowned organisations, and we bring them together under the UKIHMA umbrella and offer their expertise to international markets. So in drawing to a close, I hope that's given you a sense of the passion and the ambition that UKIHMA has in working with international clients and the international healthcare market. We'd be delighted if you got in touch with us to just talk about how we might work with you. And our contact details, you'll see there, the email is membership@ukihma.co.uk. But also we've just launched our new refreshed website, and a lot of the information that I've spoken about is on the website, and you'll be able to then see a little bit more about us and perhaps get in touch with us. So please do visit our website, and happy to speak to you if that would be helpful. So thank you very much.
Thank you, Jenny Scott, the General Manager from UKIHMA. That was a really informative insight to the work of UKIHMA. And don't forget, Jenny said they've got their new website there, ukihma.co.uk, if you would like to find out more.